A new study on the popular diabetes drug Mounjaro showing more potential health benefits. ABC News medical correspondent Dr. Darien Sutton is here with more. Dr. Darien, it's always great to see you. So there's been this constant trickle of new data on the benefits of these GLP-1 drugs. This study, you say, though, is different from what we've seen before. Why is that?
Well, this class of GLP medications has grown in popularity year after year, well known for their injectable weight loss medications, Ozempic probably being the most popular. Well, now research is coming out more and more that their benefits are potential beyond diabetes, beyond weight loss, but in reducing the risk of death from cardiovascular disease. And for the first time, researchers were able to compare two popular products, one being Mounjaro, which is a more modern version, I would say. Technically, it targets two hormones. Its active ingredient is tirzepatide, the same in Zepbound, and it compares it to Trulicity, a more traditional version. It targets one hormone in a similar way that Ozempic does.
This is really fascinating because we continue to hear more about what these drugs are capable of.
Yes.
But what did this study find in real numbers?
Well, in real numbers, it found that both of these medications, Trulicity, the more traditional version, and Mounjaro, the more modern version, reduce the risk of cardiovascular disease. But Mounjaro seems to do it better in terms of reducing the risk of cardiovascular death from heart attack and stroke, 8% lower risk compared to Trulicity. And in terms of overall risk of death, a 16% drop. So it's really significant, and it broadens the scope and helps us to understand more about the possible future of these medications and guiding patients to options depending on their risk.
Well, and with that, there are so many options out there right now. So what should someone consider here?
Yeah, there's no doubt. This market is crowded. And with the investigation and research that's coming in, the pipeline is going to even grow more. So there's going to be more medications in this class. I think it's important to understand that there's no clear winner. When you're trying to understand these medications, you need to know that they have variation in effectiveness. There's different dosages. Some have different insurance coverage options. And also some have different side effects. So that's why it's important to talk to your provider. But most important with these medications, understand that they're lifelong medications in the most part because these are chronic diseases and conditions. So you want to make sure that you pick the choice that has the ability to be more sustained and more comfortable in general of your own life over time, because this is a medication that you'll likely be on for a long time.
I don't think there's any medication we've talked about more over the past couple of years.
Truly.
Just incredible what it's done. All right, Dr. Darien, thank you so much. We appreciate you.